breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone, welcome back to this week's episode of Brainstorming with Dr. Glenn Harrison and myself, Dr. Kolby Condos. Today, we are going to break down one of the most common conditions that affects millions and millions of Americans each year. In fact, I just recently read a statistic that it affects over 26 million people yearly, and that is diabetes. So in this episode, we are going to break down the differences of type 1 and type 2 diabetes, and maybe what the pathophysiology is of it. And basically what that means is, how it happens and what is the difference between type 1 and type 2. So without further ado, let's get this thing started. How's the week going for you, man?
It's going good, Dr. Kolby. Thanks for asking. It's been busy, but it's been good, and it's just the start of the week, so the wheels are turning. But yes, diabetes, type 2, type 1, prediabetes, it's everywhere. And like the statistic that you mentioned, the one that I came across, I remember this was about a year ago, it was expected that 50% of the population in the United States are either pre-diabetic or diabetic. Diabetes alone is expected to destroy our current medical model because it's so costly. So it is everywhere, and it's frightening. It's absolutely frightening, and a lot of people don't know what it's all about. I know you get clients where people don't know what it's about. They're given a medication. They're told, as long as you follow your medication, you'll live a healthy and happy and normal life, and that couldn't be farther from the truth. So I'm really excited to jump into this to kind of lay out the groundwork and just make it clear for people, if they've been diagnosed, if they have family history of it, or even if their blood sugar isn't quite diabetes, but if it's in a pre-diabetic state, hopefully create some clarity for them.
Yeah, this is going to be huge. I think this is going to be an incredibly useful tool, not only for people who are diabetic, but also those who have family members that are diabetic or actually are pre-diabetic. So I'm really excited to get started on this. So let's go ahead and get started with the two different types of diabetes. So initially, we kind of classified diabetes as two types. There was type 1, which was juvenile, and type 2, which was adult onset diabetes. The problem with that is that statistic has shifted, and it is no longer only adult onset diabetes. We actually have children that are coming in with type 2 diabetes now, which is a total disaster. I mean, I have a 7-year-old that is diabetic already, and it's not type 1. But the large difference between type 1 and type 2 diabetes is type 1 diabetes is actually an autoimmune disease where, the cells in your pancreas that make insulin are being destroyed by your immune system. So we talked, in some previous episodes about how, the thyroid has an autoimmune disease and your immune system is ramping up and it's making these antibodies, which are little soldiers that go around and kill your own tissue. Well, that same thing is happening in the pancreas. The pancreas is responsible for producing insulin in response to loads of sugar in your blood. And if you do not have the ability to produce insulin, well, then that would be from autoimmune disease. Well, then that would be type 1 diabetes, which is juvenile diabetes. And you would have to use insulin injections or an insulin pump to actually manage the sugar load. You want to go into type 2 for us?
Yeah, I'm going to touch briefly on type 1 just for maybe some of the people that need a little more clarity. Type 1 you'll usually see in children. So if you know of a child, or maybe you have one, or a family member where there's a little kid, I don't know where the diagnosis usually happens, 6, 7, 8 years old, usually 10 maybe, sometimes later, where they're not growing, they tend to be more lethargic, they're always eating, and they're very thin. That is a candidate and they have energy crashes all the time. That is a candidate for screening for type 1 if it's not already diagnosed. So usually it's caught early. Type 2, that makes up 95% of all diabetic cases. It's not as common as type, or it's much more common than type 1. Type 2 is usually adult onset. That's what we used to call it, right? And it was later on in life where when people are a little bit older, you don't necessarily have to be overweight to have type 2 by no means. But your blood sugar is higher and higher and higher, gets higher and higher and higher. And it's when your pancreas can't make enough insulin to keep that down. So you have this high circulating blood sugar for whatever the reason, whether it's through cortisol, we'll talk about that, if we have a chance. If it's foods are a big factor in all of this, where your circulating blood sugar in your blood gets too high and your pancreas is overworked. And pancreas actually wears out. So if it has a shelf life, they like to say, but it can't keep up to take that circulating blood sugar and put it in the tissues as a form of storage. So type 1 is where you can't make it because your pancreas is being damaged. Type 2 is where you can't make enough of it. You can't keep up. And that makes up 90 to 95% of diabetic cases in the country right now. So I'll let you take it there from there, Dr. Kolby.
Yeah. So one other thing that I think is really important for type 1, and I just thought of this because actually one of my good friends has type 1 diabetes, is he was actually diagnosed because his mother noticed that he was going to the bathroom a lot. He was actually peeing a lot. So that's called polyuria, right? So if you're peeing, if you or yourself or your child is peeing a lot and he's peeing frequently even throughout the night, then maybe get that investigated, because that's a really early symptom of diabetes, especially type 1, is lots of urination. So when we break down, the demographics of type 1 versus type 2, type 2 diabetes, Dr. Glenn mentioned that this is going to be, basically a financial and, a financial disaster, not only for Americans and their out-of-pocket expenses, but also for the health insurance companies. And that's because a lot of it is tied to like diet and exercise. Yeah. So we look at it and a lot of us follow the standard American diet, which, they abbreviate as SAD. And that just has to do with, we have a lot of refined sugars, a lot of simple carbohydrates, and basically our food is manufactured or has a high level of involvement as far as not being simple ingredients. So when you look at type 2 diabetes, if we're eating these diets that are, high in simple sugars, complex or carbohydrates and, saturated fats, well, then all of a sudden the pancreas, you have this really large surge of glucose that hits your bloodstream, and your pancreas is constantly shooting out more insulin. And like Dr. Glenn talked about, the pancreas can actually fatigue, and it can actually, it just basically goes to heck. And that's when you can start to address this stuff. And, a lot of these patients go to their doctors, and the doctor says, all right, well, we can control it with, metformin or whatever. And while that might be beneficial initially, I think that if we look at the long-term and the longevity of it, it's much more efficient to look at, why is this patient beginning to suffer from type 2 diabetes anyways? Are they exercising regularly? What does their diet look like? Are they controlling their blood sugar throughout the day by eating appropriate amounts of, foods throughout the day? That's where finding someone who is well-versed in this type of treatment or management of these conditions is really, really beneficial for that type 2 diabetes.
Yeah, I agree. Type 2 diabetes is the most common cause of amputations in the United States. I don't know statistics on the rest of the world, but it's the most common cause. Usually war is what's blamed off all these amputees, and it isn't. It is diabetes. And type 2 diabetes, as you said, Dr. Kolby, is 100% lifestyle. It's only lifestyle. But it's not only what you eat. It is how you feel. It is what your stress, what your level of stress is. So briefly, I don't want to get tangled up in the weeds on this, but a lot of times we think it's just what we eat, but it isn't. If you have enough stress, physical, chemical, or emotional stressors in your body, what you're experiencing, sleep deprivation, your body will produce cortisol. Cortisol is one of its main jobs is to drive blood sugar. Cortisol is a hormone designed to allow you to deal with stress, giving you an on-demand fuel source to get you through the stress, get your heart beating faster, your respiration up. And if you are in that fight or flight response, that stress response long enough, and cortisol is too high for too long, you have an excess amount of high blood sugar, just like you're eating a bunch of cookies or pies or pastries or a whole bunch of sugar. And that's why I always call cortisol is like cookies. You have this avenue of blood sugar coming in your body, and if it's high enough, you can actually induce type 2 diabetes just from stress. And I think we talked about this before, Dr. Kolby, of these studies, and it was repeated over and over, where there was two groups of lab rats. One group of lab rats were they both had the same diet, of course, and one group of lab rats were shocked. They were just given a little electric shocks frequently, and that drove up their stress and therefore their cortisol high enough that they were able to induce diabetes in that set of lab rats when the other set of lab rats didn't have diabetes, just on the account of stress. So what we eat is big, but also, of course, what our stress levels are.
Absolutely. And I think a big part of managing type 2 diabetes is that you have to be proactive about it, right? Mm-hmm. So we have talked a lot about managing stress and stuff like that, but we also have to realize that this is something that gets worse the longer you have it. When you look at type 2 diabetes, you can actually become what's called insulin resistant. So what happens is you eat a large sugary meal or whatever, you have like a stressful event, the sugar gets dumped into your bloodstream, and then all of a sudden you inject more insulin. Well, the cells are no longer receptive to that insulin, so the sugar floats around longer in your bloodstream. This comes with a whole host of negative effects. There's a couple of cells in your body that are actually directly able to absorb or take up glucose, and this is when you hear about things like diabetic retinopathy, diabetic neuropathy, diabetic nephropathy, cardiovascular disease, stroke. All of these things can be complications of long-term diabetes or unregulated diabetes. So it's really important. And if you have diabetes, this is where we'd like to press you and really encourage you to become proactive about the treatment and management of your diabetes, seeking out a qualified healthcare professional, talk to your doctor about it, because the longer you wait, the harder it's going to get, and the more significant your health is actually going to suffer from this.
Exactly. And you hit a point where if someone has, they're just over the line of diabetic, they sometimes it's dismissed. Sometimes even their medical provider or their healthcare provider says, well, it's not too bad. Any kind of high blood sugar is bad. It's poison. It circulates the blood. Like, as you said, Dr. Kolby, it kills the arteries in your eyes, so that it creates blindness. It creates nerve problems, most commonly in the feet. We call this peripheral neuropathy. It creates brain problems. People who are pre-diabetic or diabetic, the last statistic I read, where their risk of dementia and Alzheimer's went up 300 to 400%. So this is something to not be looked at. I think blood sugar alone, and I think you're on the same take of me. I think it is the plague of our modern world. I think it is the cause of so many problems. And I know we're talking about high blood sugar, but some people, usually when they're high, they're not staying high. They have drops throughout the day. They have surges and drops and surges and drops. And then, so, I know we could stumble upon this forever, but what symptoms, maybe Dr. Kolby, what symptoms would you say, someone's listening to this podcast or watching the video, what symptoms would you say, if someone doesn't have any lab work, what symptoms would you say that could be maybe a red flag or should be of concern, and they should go see their primary or their healthcare provider?
Sure. So I actually had a patient today that I think has undiagnosed diabetes, and she came in because she'd had numbness in her feet, and it's not real bad, but it's just a little bit. And she also came in, and her main thing was she had really a lot of difficulty concentrating mentally. She came in and she's like, I feel foggy. I feel it all the time. I'm forgetting where I put my keys. My dad had Alzheimer's. My dad also had type 2 diabetes, so I'm worried that I may be developing Alzheimer's. And I'm like, I'm thinking diabetes, you know what I mean?
Yeah.
You're 48 and she actually fits the profile where, her waist to or hip to waist ratio is in that classic, that shape that you would assume is a diabetic. Cause there are some classifications that you can look at that maybe would help you diagnose and develop a criteria for someone who you might think is a diabetic. But yeah, when they come in, or she came in and she told me, she's like, I have numbness in my feet. It's not really bad. And I'm having difficulties with brain fog. And then I asked her, are you peeing a lot? She said, oh, I'm peeing a ton. Yeah. Check. We're going to get a hemoglobin A1C and we're going to see where you're at, because I think you're diabetic or pre-diabetic. I think everyone probably knows someone who is diabetic. And that's why we decided to do this, because it's such a huge part of everyone's daily life now. If we can even, prevent or help one person from developing diabetes, and that's a part of our goal.
Exactly. So many people, I've had people come into the office, and I still remember this one gentleman, a great guy. He came in with his wife. His wife had concerns, had health problems. And then once we were starting to talk together, the husband was like, wow, well, I have numbness and tingling in my feet. and it's really bad. It's actually getting harder and harder to walk. But I've been on insulin because he was so bad, his pancreas wasn't producing anymore, kind of like more type 1 diabetic. He converted from a type 2 to type 1, also called a type 1.5, when his pancreas was exhausted and gave up, not necessarily autoimmune. And he had this numbness and tingling in his one foot, and he was having a hard time to walk. And he said, well, what do you mean that I was told as long as I go on my medication, I'd have nothing to worry about? So you're saying, Dr. Harrison, that this numbness and tingling is due to my diabetes? And I was shocked that all the misinformation, he was not told by his prescribing doctor that the numbness and tingling was diabetes, and he had to do something more than just take the pills and take the injections to curb it. It was heartbreaking. He actually, he teared up because he wasn't told that. And like you said, Dr. Kolby, if there's one person that this can inspire, and they recognize type 2, the majority of all diabetic cases are lifestyle, diet, stress. And if those are conquered and taken over, you can, depending on how far it's gone, it could be reversed. I've seen it. Catching it early, because it does get worse with time. Remember that pancreas has a shelf life. The more you abuse it, the worse it gets and the less it performs, and it really doesn't want to generate. So, yeah.
Well, I also just realized when I was going through some of those, the symptoms and side effects of diabetes, and I didn't really break that down. So I'm going to go ahead and do that real quick.
Okay, great.
So when I said nephropathy, neuropathy, retinopathy, all that means is so when you have diabetes, these cells absorb the sugar. It damages either the blood vessel or the nerve or the cells directly. And basically what that means is it can cause kidney disease. It can cause blindness. It can cause numbness, tingling, burning pain in your feet, or it can cause cardiovascular disease. So now that we've got kind of taken care of that, that's where, and that when Dr. Glenn said that, one of the leading causes of amputations in this country is because of diabetes, it's because the blood flow is interrupted to the extremities, specifically like the lower extremities, because the blood pools there a little bit longer, and it's around that sugar, the blood full of sugar. And number 2 is a lot of these patients, in fact, one of my good friends, his father was a diabetic and he stepped on a thumbtack. His feet were completely numb. He developed gangrene in his foot, and they actually ended up amputating his leg at the knee because he didn't know that he had developed an infection, and they literally didn't know until they started smelling it, and he got really, really sick. He almost actually passed away from this. So take it seriously. If you have it, make sure you're being proactive about it, not only through your medication. And we're not saying don't take your medication. Take it. Be proactive about your diet and your lifestyle and mitigating some of that stress, whether that's at work, whether that's at home, taking some steps that maybe you can even if you drop your stress level by half and you're exercising and dieting the right way, you're really stacking the deck in your favor.
I completely agree, Dr. Kolby. On the next podcast, I'm probably going to talk a little bit about my personal story and diabetes and prediabetes. But, I'll do it in the next podcast. But being proactive is everything. It's absolutely everything. And prediabetes, if you're only a pre-diabetic, don't call it just as only, because that means your body's on a path in the wrong direction. It's going to get worse. It's going to get worse until there's changes being made. But I have seen cases we had, and we'll talk about lab tests, I believe our next talk, but I had, a severe diabetic. It was already on insulin, and I think insulin was prescribed prematurely, but that's not my wheelhouse. But through aggressive changes, he had to have a hemoglobin A1C of under 5.7 to be normal. And he was at an 8.9. This is extremely high. This is a severe type 2. And within 4 months, and I know you have cases like this, Dr. Kolby, within 4 months, and this guy was a rock star. He followed everything we put in place, and we did everything. He was still, it didn't disrupt his life. He leaned out. He drove his energy. His brain fog went away. His urinary frequency went away. His numbness and tingling in his left foot went away. And we got him to a 5.4 hemoglobin A1C. He was off all meds. So
that's awesome.
Possible.
And all it took was some hard work and dedication.
Yeah. Exactly. And a good guy, a guide, a doctor can't cure this. They can't cure it. There is no cure for it. The only cure is lifestyle. And if it's done right and strategically, And that doesn't mean lifestyle. Some people think natural docs is a whole bunch of just supplements. No, in fact, that can cause problems. But it's little changes that you build up over time.
Right. So if you found value from this, please share it with everyone that you know. Share it with anyone that might be suffering from diabetes or has been diagnosed with diabetes, anyone you might suspect has diabetes, or anyone who needs a little extra motivation to control their diabetes. The next episode we are going to do, we're going to talk about, if you suspect that you're diabetic, what are some tests that you can request or have ordered, and then what to do depending on the outcome of those results. Again, it'll be Dr. Harrison and myself breaking it down for you. As always, you guys can get a hold of us at our emails, northlakeschiro@gmail.com, or you can get on our website, which is www.northlakechiropractic.com. If you have any questions, please feel free to get a hold of us. Dr. Glenn, drop your contact info.
Yeah, if you want to learn more about what we do and what our approach is, and loads of information, there's even diabetic information on their lab tests and everything. www.drgharrison.com, or just Google the Center of Functional Medicine, Denver, Colorado, and you'll find us.
So thanks, man. I'm looking forward to breaking this down a little bit further in the next one, and I can't wait to do it again.
Awesome. Thanks, Dr. Kolby. We'll talk to you soon.